For Insider Medicine In-Depth, this is Davin Johnson. The risk of dying remains increased for years following hospital discharge for a traumatic injury, according to research published in the Journal of the American Medical Association. Here are some tips to help you reduce your risk of being injured. Always wear a seatbelt when in a moving vehicle. Watch out for throw rugs and other tripping hazards in your home. Always wear a helmet when biking, skiing, or riding a motorcycle. Researchers from the Harborview Injury Prevention and Research Center analyzed data available on nearly 125,000 adults who were hospitalized for a traumatic injury between 1995 and 2008. The investigators looked at the patient's risk of dying in the years following the injury, as well as the factors that influence this risk. The risk of dying 3 years following a hospital admission for trauma was 16%, compared with a death rate of only about 6% for adults of similar age and background who were not injured. During the 14-year study period, in-hospital death rate dropped almost by half, but the long-term mortality rate actually increased. Older patients, as well as those who were discharged into the care of a skilled nursing facility, had a higher risk of dying, as did those with more severe injuries, those who were injured by a fall, those whose level of independence was diminished by the injury, and those on Medicare or other government assistance. Today's research highlights the relative frailty of patients following a trauma. In order to better understand how well hospitals are treating these patients, researchers should follow their progress for several years after the injury. For Insider Medicine In-Depth, this is Davin Johnson.